When you are finding it very difficult to get pregnant, like you've been trying to get pregnant, or you as a man, you have been trying to get your woman pregnant and you are still unable to get her pregnant, you should know that there is a cause or there is a reason why that woman is not getting pregnant. And those are the major things I'm going to be explaining in this video, so you will know the major thing that might be making your woman not to get pregnant, and as a woman you might know what is making you not to get pregnant, so you can adjust to achieve your goal of pregnancy. The first thing you must consider when you're finding it very difficult to get pregnant is ovulation. As a woman, are you meeting your partner during your ovulation days? This is a question you should be asking yourself. And that's why you as a woman, you must always study ovulation days to know when you are fertile, so you can communicate that to your partner and your partner can meet you when you're ovulating. Because when you are only meeting your partner when you're not ovulating, you're just meeting your partner for fun, because there will not be egg to be fertilized. And once there's no egg to be fertilized, you can't get pregnant. The other thing you must consider is your man's swimmers count. Are his swimmers count healthy? Is he producing enough swimmers count? Are they motile? Are they moving very fast? These are the things you must also consider. So when you are finding it very difficult to get pregnant as a man, it's always advisable you go for a fertility check so they can collect your swimmers count, check the motility, check the numbers, check the health of them to know if they're healthy to pregnant your woman. The other thing you must also consider is an infection. As a man or as a woman, you must consider an infection very well, because when you have an infection in your body, it can make the epididymis inflamed. As a man, it can make the place where you store your swimmers count, where the swimmer counts are being stored, to be inflamed. And once they are inflamed, it will make you not to produce healthy swimmers count, and that's why you might not be able to pregnant your woman as a man. As a woman, when you have an infection can cause inflammation to so many organs in your body that would make you not to get pregnant. The first organ that might be inflamed are your ovaries. Once the ovaries are inflamed, that means you might not produce healthy eggs. And when you don't produce healthy eggs, you can't get pregnant. The other thing that might be inflamed when you have an infection is fallopian tubes, the tubes that connect your ovaries to your uterus, to your womb. Once they're infected, they might make you to be having ectopic pregnancy, where pregnancy will be having inside your fallopian tube instead of your womb. And this will make you to be having recurrent miscarriage. And that's why you must always treat infection at early stage. You might also have inflammation of your womb, inflammation of the uterus, whereby when the egg is being fertilized, when it gets there, it will not even stay as pregnancy. So you will not get pregnant and it will just flush out. And you might think it's a normal bleeding. It's not normal bleeding. It's because most times your uterus is inflamed because of an infection. And once the uterus is inflamed, there's no magic you can do to get pregnant. And that's why you must always treat an infection at early stage. The other thing that can also happen when you have an infection is inflammation of your cervix. Once the cervix is inflamed, the neck of your womb, you might not get pregnant, or when you get pregnant, you might experience miscarriage, and you might not even know you are pregnant, because when you just notice a kind of little bleeding after 1 month of missing your period, you might just think it's a normal thing, maybe you missed your period or something, so many other things like that, not knowing it's miscarriage. And that's why you must treat an infection at early stage. Subsequently, I'm going to be making a comprehensive video on the things you should consider when you're finding it very difficult to get pregnant. I'm going to be talking about hormones, some kind of factors like that, drug factors, and so many other factors like that, so you know which one fits you and you can adjust to get pregnant if you have been wanting to get pregnant. So if you enjoyed this video, please do well to follow my page. Also share this video to as many people as you can, and you might be saving the life of someone. Don't also forget to drop your comments on the comment section so I can respond to them as soon as possible. I'll see you next time.